afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and in Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media who are in attendance as well this afternoon. And a reminder to submit your questions using the question forum here on Microsoft Teams. Just click on the text bubble with the question mark and indicate your name as well as your media outlet and who your question is directed to when you submit it here on Microsoft Teams. And welcome to those joining us this afternoon who are viewing today's briefing on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's begin with our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. We know Good Friday is tomorrow, but I'm not sure that today is a good day for London, and certainly not a good day for Ontario. We're not under lockdown. Instead, it's being called shutdown. But make no mistake, this is serious. It isn't simply about COVID anymore. This is about our healthcare system at large. The virus is now posing a threat to the system's ability to deal with regular ICU admissions and the ability to care for all patients, COVID or otherwise. We're seeing younger people wind up in the hospital, and the risk of ICU admissions is 2 times higher with variant infections. Make no mistake, the third wave is here, and it continues to grow. And so the Premier had no choice but to act. So I appreciate the provincial government for putting small business on a level playing field with big box retailers. It's certainly something I've long called for. Based on the order handed down today by the province, the rules are now the same for both. Big box retailers and smaller retailers are both allowed to remain open at 25% of usual capacity. I must say, though, I'm perplexed as to why restaurants are no longer allowed to offer outdoor dining on patios or other controlled settings. Based on a host of other outdoor activities which are permitted under these new regulations, it just seems curious as to why outdoor patio dining is not. And I feel awful for local restaurant owners and their employees, who will no doubt be impacted so dramatically by this decision. So what can we do? At this point, all we can do is, what I would like to say is strongly encourage all of you to take advantage of curbside pickups at restaurants or order directly from the restaurants themselves instead of using those third-party apps which have such a direct financial impact on these restaurants. Let me leave you with this. Regardless of whether we're in gray, shutdown, or lockdown, these designations in and of themselves don't fix a thing. Our behaviors are what have caused them, and it will be our behaviors that solve them. Unless or until we make those changes, our circumstances are going to remain the same or worse. I'm hopeful this is not only a wake-up call, but a turning point in our battle against COVID. So, sincerely, with all of the challenges associated with what this has led up to where we are today, on a brighter and perhaps even a happier note, let me wish everyone a joyful and happy Easter, and we'll do our best because Londoners do their best. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. So on the case front, you've seen the numbers. We had over 80 cases diagnosed in the region yesterday. Very concerning, the number of variants of concern, 57 of those reported. So variants of concern, which 2 weeks ago represented 10%, maybe 20% of our cases, are now approaching 50%, and some days beyond that rate. We know the variants spread more easily. We know that they are more dangerous to young people. So that is obviously something we're watching very closely. The vaccine campaign is continuing apace. We are still vaccinating about 2,000 to 2,200 people each day. We're also seeing the number of vaccines becoming available in our community start to increase. The projections for Pfizer are pretty stable, but our Moderna projections are starting to go up. in the next couple of weeks. So we will start to have more supply on hand, not the doubling that we currently have capacity for, but every bit helps. The other availability of vaccine is around AstraZeneca. You saw the announcement today of 2 pharmacies in the London area, as well as a number of pharmacies in neighboring communities, where everyone over age 55 will be eligible to receive the AstraZeneca vaccine. That's great news. It's a great vaccine. The other route where the AstraZeneca will be available over the next week or 2 is through certain family practices. What we've done is we've asked the primary care community to come together and create hubs where a number of family doctors will be able to gather together and offer vaccines to the patients. The hub model is necessary because of the logistics of the vaccine. You need to have enough sort of a critical mass in order to justify setting up a vaccine clinic. And by bringing a number of practices together, we think we can do that. Very much a pilot. We will announce locations as soon as we can, but we're not going to be announcing that today. But there will be 6 or 7 locations across London and Middlesex where family doctors will be offering the AstraZeneca vaccine as well. Obviously, the big news today is around the move to a province-wide shutdown, which from what we understand will be similar to the gray lockdown level of restrictions in the color code framework, but without some of the exceptions that have recently put in place. For example, restaurants and outdoor fitness, as well as certain personal service settings, have been permitted in the gray zone. That will not be the case in the province-wide shutdown. Dan, I'm sure there are questions, so I'll pause there.
Thank you, Dr. Mackie. Thank you, Mayor Holder. Yes, we do have a lot of questions, and not surprisingly, there are questions about the rollout of vaccine to pharmacies, as well as questions about Western University. So let's start there. Our first question this afternoon is from Jane Sims at the London Free Press. Dr. Mackie, this one is for you. With Western's announcement to move online and urge residents, students to move out, can we infer that students are a major driver of the case count? Can we expect our numbers to stabilize once the students return home?
Well, I appreciate the question, Jane. Students are not a major driver of our case count. They are important contributors in terms of the variants of concern. We haven't seen a lot of spread from the student community into the general community, and we know that this will be a relatively small part of the puzzle. You know, we did have great conversations with Western administration last night in order to support them making this decision. I think they've made a good decision, and it will help. But this doesn't mean the pandemic is going away. We have spread across our community. We have, you know, the variants of concern growing. We have the wild type previous variants also increasing exponentially in our community. So, you know, removing the Western factor should make some difference, but it will not be the silver bullet here.
Thank you, Dr. Mackie. The next question is from Amanda Taccone, who is with CTV London. And welcome, Amanda. I think this is the first time that you've joined us for one of the briefings. Dr. Mackie, Amanda asks, how serious are the Western outbreaks? This has to be troubling coming at a time when exams are about to begin.
You know, the concerning thing around these Western outbreak is that it's not just one. So you're seeing variants of concern and outbreaks of, you know, around a dozen people in several different settings of Western. That means the variants have been spreading for some time, and it means that people have been gathering in unsafe ways for some time in order to see that much activity across the community so quickly. So those are the big concerning things. You know, what I like about exam time is that the students are home studying, or at least they should be. And so as long as that's the case, that should prove to be a positive factor here.
Thank you, Dr. Mackie. And there was a follow-up from Amanda Taccone as well as we go to that. Dr. Mackie, how will booking for pharmacy vaccinations work? Will it be through the provincial website or through the pharmacies themselves?
Yeah, we don't have a lot of direct information about booking in pharmacies. You do have 2 that are available in this area. There's a Costco and there's a Shoppers Drug Marts. You'll want to be in touch directly with those pharmacies to see what their booking system is like.
Thank you very much, Dr. Mackie. Let's go to the next question, and it is from Andrew Graham. And this is again a question about the pharmacy rollout. Do you know when the 2 local pharmacies announced today, Shoppers and Costco, will start providing the vaccine?
We don't have that. It looks like the mayor might actually have that information.
Mayor Holder?
The advice I would give is go to the 3 pharmacies, and I wanted to correct that, it's not 2, it's 3 pharmacies in our area, the 3rd being in Stony Brook, and that information should be, if it's not on the health unit's website, we can certainly provide that to you, but I'd go directly to their website to understand clearly the enrollment process.
Thank you, Mayor Holder, and thank you, Dr. Mackie. The information is changing very, very quickly. So yes, we are doing our best to keep the Health Unit website updated with the latest information. You can find that at healthunit.com/novel-coronavirus. Andrew Graham has a follow-up question for you, Dr. Mackie. Now that we're entering Andrew says shutdown, and that is the language that we're using. Do you have any updated guidance for those looking to celebrate Easter and Passover this weekend? Is it best to opt for virtual services rather than limited in-person ones?
Yeah, no, certainly appreciate the question, Andrew. I think that when it comes to celebrating the Easter and Passover holidays, absolutely virtual services are much better. Small outdoor gatherings, if any, preferably no gatherings. It's just not the time. We have this 3rd wave that is raging into our community. Put it off, spend some nice time together in the summer. Let's all make sure that we can make it there.
Thank you, Dr. Mackie. The next question is from Merrick Sutherland at CTV London. Dr. Mackie, this question is regarding schools. Minister Lecce mentioned enhanced measures that will be introduced to keep students safe and schools open. Has anything been communicated from the province as to specifics of what that might look like? And if not, are there measures that you will recommend to enhance what is already in place?
So what we are seeing in this community, and from my interpretation across the province, is that there has been, continues to be, evidence of very little spread in schools. If we have school-based outbreaks, it is, so far 2, maybe 3 cases in this term. In the fall, we may have gone up to 5 or 6 cases, but most of what we're seeing is reflective of spread in the community. So almost all of those cases of COVID that have been diagnosed in students are reflective of spread in the community and were acquired at home or some other place outside of school. We know this for a few reasons. First of all, when we test somebody positive in a school setting, everyone that they've been in close contact with is directed to go for testing, and we see very few positives come out of that. It's in the range of 0.5% this term. Of the close contacts of a positive case in a school are coming out positive. If we test those that are asymptomatic and haven't had a close contact, the rate is even lower. In fact, the first 112 tests we did, asymptomatic tests in schools, we had zero cases come back positive. So there really is not spread in schools. What is happening in schools now is safe. We believe that the measures that are in place need to be continued. I understand it can be tiring, and for students and teachers, they're probably all very tired of this. But I can tell you that in London and Middlesex, they're doing a tremendous job. They're keeping each other safe, and our schools continue to be the best place for students.
Thank you, Dr. Mackie. Heather Rivers at the London Free Press has a question, and it's about Western University. Dr. Mackie, Western has basically shut down sending those who can go home. How big a problem did you find with the variants of those afflicted by COVID-19? Did all of the Western outbreaks have variants of concern? Is there a concern they may be taking COVID home to their families in regions where there have been relatively few cases?
Yeah, at least 3 of the 4 outbreaks in the residences and also the outbreak in the business students have all been linked with variants of concern. So at least 4 out of 5 are still waiting for some of the variant testing to be done. That is a concern. It's a sign, once again, that the variants can spread more easily, they spread more easily in young people, and they can actually, we know from other jurisdictions, be more dangerous in young people too. And in the range of 50% to 60% more likely to put a young person into the intensive care unit than the previous variants. In terms of bringing COVID home to their home communities, obviously that is a concern. And so in working with Western, we've directed that students quarantine for 14 days when they do return home to their home communities.
Thank you, Dr. Mackie. The next question comes to us from Travis Dolany at CBC London. Dr. Mackie, how many cases are associated with the latest outbreak at Medway Sydenham Hall residence at Western University? Additionally, how many cases have been confirmed at the other outbreaks at Western? I realize there's a lot of numbers there and things are moving quickly, so hopefully you have some of those right there at your fingertips.
Yeah, the Western, the Medway Sydenham residence has, as of yesterday, 5 cases. The Elgin Hall residence, 8 cases, and the other 2 are still where we had reported them. I believe they were around 11 cases. We have some other community-based outbreaks associated with barbecues or other social gatherings that are in the range of 8 to 11 cases each as well. Saugeen Maitland, 3 new cases yesterday for a total of 15 at this point. Otherwise, we haven't seen changes in the other outbreak case counts at Western recently.
Thank you, Dr. Mackie. Yes, a lot of numbers to keep track of there for sure. Travis does have a follow-up question. With the majority of recent cases involving people in their 20s and younger, Dr. Mackie, do you know what the contributing factors are that are leading to this situation?
What's happening there is what we call risk stratification. So even though the vast majority of people, including students, are taking all appropriate precautions and behaving safely, you have a subset that are not, and they're now finding each other and finding ways to gather that that they feel are worthwhile, even though there is a risk associated with them. And so when you get this subgroup that is taking high-risk behaviors, even though the rest of your community might not be doing so, you can see sustained spread in that subgroup because they have new close contacts all the time. So that's what's happening. That's what's really concerning. And that's why asking students to return home will be part of the solution here, helping to break up those chains of transmission.
Next question, Dr. Mackie, comes from Randy Richmond at the London Free Press. Dr. Mackie, does the health unit know how many doses of the vaccine are coming to local pharmacies in the first phase?
Yeah, we don't get the information directly, so unfortunately I don't have that. As you'll see, the official information I have is that there are 2 pharmacies in the region. The mayor's already got better information. He knows of the 3rd. The provincial website that I've just posted will show where the pharmacies are near your community or your postal code. There's still just 2 listed on there, but it sounds like there's a 3rd in the works, and we don't know what the doses are.
The next question, Dr. Mackie, is from Emily Taylor at the Western Gazette. Hi, Dr. Mackie. Are there any updates about the community outbreak declared on March 11th? It was associated with gatherings involving Western's fraternities and sororities. Are there any additional cases in Western's Greek life?
So the large student off-campus outbreak still has a total of 49. We haven't had more cases coming in associated with that series of events.
Thank you very much. And let's go to our next question, and it is a follow-up from Emily Taylor. And this is, again, a numbers we'll see. Dr. Mackie, do students still make up around 1/5 of London's overall cases? Got ahead of myself there.
Yeah, they're in that ballpark. They're in the kind of 15 to 20% of our cases here.
And another question from the Western Gazette. How does the Middlesex-London Health Unit recommend that students with COVID-19 positive, I'm thinking, yes, should be transported to quarantine locations?
Yeah, so the process for getting to quarantine is people would use their preferred method of transportation, and of course masking along the way. If they are not able to, take their own vehicle or walk, we would ask that they try not to use public transit and use a private taxi, notifying the driver so that everyone can make sure they're taking appropriate precautions. Once people are in their homes, we work with them to make sure that they are able to quarantine there. It's preferred that they have their own washroom and avoid sharing meals and meal preparation spaces with others. If individuals, especially students, don't have facilities that allow them to keep separate, then we'll work with the university, and often the university has solutions in place where they can get those folks into accommodations that are appropriate for quarantining.
Thank you, Dr. Mackie. Let's go to the next question from Matthew Trevithick at Global News Radio AM 980 CFPL. Dr. Mackie, the Health Unit dashboard is now showing some screen variant cases as having 2 detected spike gene mutations with plus and minus signs next to them. What do these distinctions mean?
So I'm not exactly sure what the question is asking. If maybe Matthew can reword it, or we can follow up afterwards by email.
Yep, that sounds great. Thank you. So Matthew, if you want to reiterate the question, or we can follow up. Dr. Mackie, you have it?
Okay, I think I found what he's referring to. So you've got 2. So let's talk a bit about the testing for the variants and how that works. So COVID testing is genetic testing, but it doesn't do the entire genetic fingerprint. What the COVID test does, the standard COVID test, is it looks for specific parts of the gene that are easy for the test to identify. Once it picks those up, it replicates them to the point where it can be detected by the probe that the lab is using, and then you've got COVID in your sample. There are 2 specific pieces of the gene, of the COVID genes, that indicate whether the variant is a variant of concern, and on the other hand, whether it has some resistance to immunity. And those are the 501, so N501Y mutation and the E484K mutation. Those 2 mutations refer to 2 places in the COVID genome where certain variants have developed this 501 mutation, which indicates that it can spread more easily, the variants of concern. So 501 mutation is common among UK, the South African, and the Brazilian variants. And then the E484K mutation is about having some resistance to the immunity that the human body will raise against the virus. And so you can have a variant that is positive for one of those mutations, but not positive for the other. That's what the plus and minus would mean. So, for example, we've had one case that is positive for the 484 and negative for the 501. And then if you look further down, you've had 46 that are positive for the 501 and negative for the 484. And then you can have them that are positive for one or the other. The testing is evolving, so you don't have all of the positives and negatives for each of those. That's why you see some that have a positive for one and they don't indicate whether it's negative for the other or not. The next step after that screening is done, that's all still screening, it's not the full genetic fingerprinting. The next step in the test process is that whole genome sequence where they will map out the entire genome of that specific variant of COVID that the individual has. And once we have the whole genome sequencing, then we know if it's UK variant, Brazilian variant, South African, or something else. And that's when we would know for sure what the source is and the characteristics. The 484 mutation is often in those 3, but it also can be found in samples that are not 501 positive, so there are some other variants. And that's what you're seeing there. So the plus means it's testing positive for that. mutation, and the minus means it's not.
That was quite the explanation. Thank you, Dr. Mackie, for that. Next question, we've got a couple from Andy Yang at the Western Gazette. We'll see if we can bundle these together. These are all related to outbreaks at Western and involving Western students. Dr. Mackie, what is the latest with the Western outbreaks, and are there any new cases? I think we've spoken to that already, Andy. How many cases are related with the outbreaks? Are variants of concern? And maybe we've answered that question a bit with how the variants work. And the last question, are there any new outbreaks related?
Right now that are variants of concern.
There we go. Thank you for the question and questions, Andy. Let's go to the next one. Dr. Mackie. All right, Matthew Trevithick has another question at Global News Radio. How many community outbreaks are currently active that have been associated with Western University and gatherings, barbecues, etc.?
Yeah, so we have 6 that are associated with Western in one way or another. And then there are a couple of other clusters that are around gatherings and barbecues as well. So another 2 outbreaks that are not Western associated, but are associated with those sorts of gatherings.
I think it's probably important to mention too that these gatherings are not exclusively Western students also, that there are other people in that age group who are not necessarily students at Western who are involved. It's not strictly a Western situation. All right, on to the next question. Mayor Holder, question for you from Andrew Graham, and it's about the pharmacies. Mayor Holder, has the Stony Creek Pharmacy on South Wenage Drive been confirmed? Only the Costco and Shoppers locations are currently listed on the province's website.
Well, hi, Andrew. Thanks. I appreciate the question because this is where this becomes a bit of a moving target. It was just a little bit earlier today that all 3 of the London pharmacies were referenced on the provincial website. Now the Stony Creek Pharmacy, as of just shortly ago, has been taken off the provincial website. So it is gone. What is there is the Costco still in West London and the Shoppers at Fanshawe Park. And so again, I think the best advice would be to refer always to the provincial website for the most current information. So Stony Creek is one that went on and is now off. So appreciate you clarifying that.
All right, thank you very much, Mr. Mayor. Wanted to come to a question now from Heather Rivers at the London Free Press. I'm just trying to get to the question specifically here, Dr. Mackie. Let me go to it. And the question is about, is it safer for elementary and high school students to be in school or at home in this stage of the pandemic? Why, and what could consequences be if they have a week off during an April break? So the question was, what could happen during an April break if students are out of school? Would it be better if it was canceled or not?
Yeah, the big concern of students being out of school is mixing with other students or others who are not in their cohort. So, we are concerned that if students are at home or in the community, that they will take that time to spend time and, potentially unmasked without appropriate distancing with students that they wouldn't otherwise be in contact with. So that has the potential to add, additional spread in the community. Schools are safe, they're supervised, and we've had very little transmission in area schools. So that is the best place for students. Now, the decision about moving spring break is obviously an enormous decision. And I think already people have been through a lot of challenges in terms of rescheduling to April from May. It's not, the public health considerations are important, and also this is a huge cultural issue for our young families. And so, my understanding is the government has made the decision not to move the April spring break again. I haven't seen the official announcement on that yet, but I believe that has been made. We will, and we'll do our best as a community in that setting. That of course reflects the government's understanding of what they believe that the community would want, and that's what the government's job is. So we of course support that.
Thank you, Dr. Mackie. We've got a few more questions from the Western Gazette. And the first one is from Anushka Goswami at the Gazette. And this is a question, Dr. Mackie, I'll ask it, but this may be a question better answered by Western University. So I'll ask it. Is Western University required to provide transportation for COVID-19 positive students when they are being moved to quarantine locations?
So that's an easy answer. It's no. Students are responsible for their own transportation.
Let's go to the next question. Andy Yang is back with another one. Dr. Mackie, are all students on affected residence floors placed under self-isolation? Are there any faculty and staff that have tested positive at Western?
So there have been a small number of faculty and staff that have tested positive. When there's an outbreak, we look closely at the patterns of behavior in the facility. So if you've got a facility, for example, one of our earlier outbreaks from maybe a month or so ago, the facility was physically very long, and you had, I believe it was 40 units on each floor, and there was a stairs at either end, a elevator in the middle, and you wouldn't expect any of the students on one end to necessarily be interacting with students at the other end. And so what we did in that situation is we put the whole floor on isolation until we tested a number of students around where the cases were coming from. And when those students tested negative, we took the rest of the facility of that floor out of isolation, because if the students right closest to them weren't testing positive, very unlikely in that particular facility, given what we were learning from the cases about the activities they've been involved in, that they would be spread beyond their immediate area. Whereas if you have a smaller facility where the rooms are closer together, or there's more likelihood that people are sharing, potentially sharing elevators and hallways and in close contact, and the social environment is more integrated, then you might see a whole floor being quarantined and an outbreak being declared in that whole floor at once. So it really depends on the specifics of the situation.
Thank you, Dr. Mackie. We do have one more question, and we are in overtime, so this is going to be it for today. Final question from Emily Taylor at the Western Gazette. Dr. Mackie, are there any updates about the group of Western staff members in facilities management who tested positive? Is this considered an outbreak? How many people tested positive?
Yes, thank you for the question, Emily. It certainly is considered an outbreak. I'm just double checking. I believe that we had 5 cases associated with facilities. Oh, sorry, we're up to 13 now in terms of staff and faculty at Western testing positive.
Thank you very much, Dr. Mackie. And that does bring us to the end of the questions for today and the end of our virtual media briefing for this Thursday, April the 1st, 2021. A reminder that we will not have a virtual media briefing on Monday the 5th, but will resume on Tuesday, April the 6th at 2 p.m. And we hope that you join us then. And between now and then, a happy Passover, a happy Easter as well. We hope you have a good weekend, and take care and continue to follow the public health guidance that is in place to help limit the spread of COVID-19. Thank you and take care. So long for now.